We are covering liver cirrhosis, a topic the NCLEX loves to test through complex, multi-system patient scenarios. Cirrhosis is the end stage of liver disease, where scar tissue replaces healthy liver cells, blocking blood flow and impairing function. The exam will not ask you to simply define cirrhosis. It will give you a patient with a history of hepatitis or alcohol abuse and ask you to identify the most immediate complication. The central problem you must understand is portal hypertension. When blood can't flow through the scarred liver, it backs up into the portal vein, causing a cascade of life-threatening issues. First is esophageal varices. This backup of pressure forces blood into fragile veins in the esophagus, which can rupture and cause a massive hemorrhage. An exam question will test your ability to prioritize. If you have a patient with cirrhosis and mild ascites versus a patient with cirrhosis who is suddenly coughing up blood, you must recognize the airway and hemorrhage risk of varices as the immediate priority. Your first action is always focused on maintaining the airway and initiating bleeding precautions. Next, this pressure pushes fluid out of the vascular space and into the abdomen, causing ascites. The NCLEX focuses on the nursing management of ascites. Key interventions are monitoring daily weights, measuring abdominal girth, and assessing for respiratory distress, as the fluid can push up on the diaphragm. A common exam trap is a question about fluid management. A patient with ascites is in a state of fluid volume overload, so administering a rapid bolus of isotonic fluids would be contraindicated. Instead, expect answers related to diuretics like spironolactone and a low-sodium diet. Remember, low albumin levels also contribute to ascites because albumin keeps fluid inside the vessels. Without it, the fluid leaks out. The most tested neurologic complication is hepatic encephalopathy. The failing liver cannot convert ammonia, a byproduct of protein breakdown, into urea for excretion. Ammonia is toxic to the brain. The exam will describe a patient who is confused, lethargic, and has a distinctive hand tremor called asterixis, or the liver flap. This is a classic sign you must know. The priority nursing diagnosis is risk for injury. The go-to medication is lactulose, a laxative that traps ammonia in the gut and expels it through the bowels. An exam question might ask how you know lactulose is effective. The answer isn't just the patient had a bowel movement. The therapeutic goal is achieving 2 to 3 soft stools per day, which indicates effective ammonia excretion and should correspond with an improvement in mental status. To tie this together, use the mnemonic HELP for the major complications: hepatic encephalopathy, esophageal varices, low albumin, and portal hypertension. A common point of confusion on the exam is diet. Historically, a low-protein diet was ordered to reduce ammonia production. However, evidence shows these patients are often malnourished. Current practice emphasizes providing adequate protein to prevent muscle wasting, while controlling ammonia levels with medication. The NCLEX will test your critical thinking here. Focus on patient safety and the immediate medical treatment, like lactulose, as the priority for encephalopathy.